I had several things that happened that made me decide I needed to lose weight. The first issue was I felt my doctor kind of gave up on me. My doctor had me with a nutritionist in her office, and I really wasn't doing what the nutritionist was wanting me to do, and I wasn't losing weight. And so the doctor finally said that this isn't doing any good. We need to just stop this. It's costing you money and we're not getting anywhere. And probably around 45 days later, a friend of mine who was about 3 months younger than I am keeled over dead. And at that point in time, I told my wife, I said, the next person to die is not going to be me. I said, I've got to do something. I chose the HMR option of the choices available through the SSM Weight-Loss Center. I chose that because I really didn't want to have to do the surgical type procedures. As heavy as I was when I started, and with all the medications that I was on, I really felt that I needed to have a physician looking over me as I was going through the program, because I knew it was going to be rapid weight loss, and I wanted to make sure that I was doing it in a healthy manner and not cause myself more problems. The HMR program is definitely not a diet. It's not a fad. It is a total lifestyle change. It does teach you all the aspects of what you need to do, and it really does make a difference. I averaged right at 4 pounds, a little over 4 pounds a week. It's just been phenomenal. The staff at the Weight-Loss Institute are phenomenal. They really teach us a lot about ourselves, about the food that we eat, how to deal with the things that we cope with and stresses of everyday life. They do keep it light and enjoyable, so you're not sitting in there, they're not lecturing at you.
Hello.
Hi, how you doing?
Good to see you. How have you been?
I'm doing well.
How was your week?
Dr. Holloway was great. He would sit there, and if you had issues, he wanted to hear about them. He wanted to be able to discuss them. He really wanted to know how you were doing and gave us a lot of encouragement. It almost seemed as exciting to him as it was to us whenever he was able to take us off of a medication, because I know as we were going through and he initially started reducing my different medications, you could hear the excitement in his voice, that he saw that what they were doing was really providing a service to us, and he was great with it.
That's wonderful.
If you follow the program and do what they recommend and say, you're going to lose weight and you're going to lose it fast, and they're going to teach you how to keep it off. When I started the HMR program, I weighed 380 pounds and wore this size 54 pants. I now, after having lost 165 pounds, weigh 212 and I'm wearing a size 38. I guess my biggest wow moments is when people see me and they haven't seen me since I started the program. I'd love to have a camera running and just look at the expression on their face. It's amazing. So many people actually walk right by me and don't even recognize who I am. They just stop and they'll turn their head and they'll look and they're like, Don, is that really you? One of my goals was to be able to play basketball again. I played basketball most of my life and had gotten to the point where I couldn't run up and down the court anymore. My knees were really hurting bad. I was having other issues on the court. And that's been exciting. I'm back playing basketball at lunchtime with all of my coworkers that show up to go out and do that. My whole attitude about everything is so much nicer than what it was. I had comments that I'd gotten kind of cranky at times at work, and it wasn't the cheerful guy that they hired 13 years ago, and they said that cheerful, happy-go-lucky person is back. And I think it's because I feel good, I'm proud of what I've done, and it's a great feeling.